Welcome back to Rural Health News, the segment of Rural Health Today, where we fill you in on the latest in rural healthcare headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. First, what's most urgent? The American Red Cross recently announced a severe national blood shortage, with supplies falling 25% over the past few weeks. One of Hillsdale Hospital's own emergency physicians was invited to speak on this issue in a local press briefing, highlighting the effect of blood shortages on rural hospitals. The Red Cross cites severe winter weather and nationwide flu outbreak as the primary causes of the supply shortage. Help us spread awareness on this issue and sign up to donate blood at redcrossblood.org. Blood supplies are vital for trauma patients, those experiencing chronic illness, and many medical emergencies where transfusions are required to save lives. On to the damage report. Let's review what we're expecting to change in healthcare in 2026. First, Medicaid policies will go through their first reforms from the H.R. 1 bill this year. While the majority of changes to eligibility requirements won't actually occur until 2027, states will need to make individual decisions about major policy items in preparation, such as eligibility, systems, processes, data sharing, enrollee outreach, and education, as well as staffing infrastructure. This year, the federal requirements for provider taxes will also go into effect. The maximum allowable tax won't start decreasing until 2027, but already states are not allowed to increase existing taxes or establish new provider taxes. This is a crucial method that many states rely on for sustaining Medicaid funding, and we'll start to see the effects of it in the reduction in 2026. Lastly, as we've discussed on this podcast before, we expect to see a sharp decrease in health insurance enrollment this year. As Americans adjust to the reality of marketplace plans without enhanced premium tax credits, we're already starting to see enrollees either drop their plan or withhold premium payments until the plan expires. This will place communities in a position without sustainable access to preventative care, putting rural populations at risk, especially as health services struggle to remain open through the upcoming reimbursement reductions. While it's not too late for these subsidies to be saved, the most recent healthcare package passed by the House did not include the extension of EPTCs. And now for today's success story. The Centers for Medicaid and Medicare recently awarded 400 new residency positions funded by Medicare to more than 130 hospitals, with the goal of expanding physician training and targeting high-need areas like rural communities with improved training capacity. Rural hospitals see a significant workforce shortage and often face unique barriers in recruiting long-term talent. So programs like this make an impact on the future of rural health. Thank you to our sources for this episode: the American Red Cross, KFF Health News, and Becker's Hospital Review.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.